Many of us aspire to be as healthy as can be. But what are some things that you can do to improve your health? We will take a look at how our lifestyle can affect our overall health and well-being. Before we begin, let's take a brief look at the health status of adults in America. What do you think this stethoscope represents when we are looking at healthy habits? Yes, it represents preventive screenings. Not fair, but I used colon cancer screenings for this measure, which most of us do not have to worry about until we are 50. About 2/3, or 66%, of our adult population does not participate in recommended screenings. Of course, blood pressure screening would be much lower because it is recognized as one of the most important screenings and is done every time you visit the doctor and even the dentist. And yes, we all know what this represents: tobacco smoking. About 18% of the population in Pennsylvania smokes. In the U.S., it is about 16%, so we are a bit higher than the national average. The good news is that this has been going down since the Surgeon General's report on smoking was released in 1964. In fact, we have more than 10 million fewer smokers since 2000. Of course, some quit, others weren't so lucky. However, e-cigarette use is on the rise, along with concerns about their potential health risks. And how about this guy? Yes, he represents inactivity. About 48% of the adult population does not get the recommended level of aerobic physical activity. And if you combine that with muscle strengthening activity, about 78% do not get the recommended level of physical activity. So, basically, if you are not meeting recommendations, you're in the majority. And of course, this is proper nutrition. About 90% of American adults do not meet the intake recommendations for vegetables, and about 88% of adults do not meet the intake recommendations for fruit. Not to mention that obesity rates are currently at about 38% for adults in the United States. Actually, our diet comes primarily from processed foods, 55% of our calories. We only get about 5% of our calories from fruits and vegetables, or natural produce when you take out the white potatoes. Research shows that consumption is lower among men, young adults, and adults living in poverty. And yes, this is stress. For this measure, we looked at extreme stress, which is identified as 8, 9, or 10 on a 10-point scale. On average, about 24% of our population says that they are under extreme stress frequently. I know what you are saying. How do I get in the 76%, right? Younger generations and women consistently report higher levels of stress. Let's take a look at health in the United States. When we look at health statistics, we often look at life expectancy and causes of death. You are more than likely aware that our life expectancy has drastically increased in the last 50 years in the United States. In the 1800s, the life expectancy of Americans was less than 40 years and substantially lower for African Americans. The predominant causes of death during this time were malaria and tuberculosis for adults, and measles, mumps, and whooping cough for children. Today, all of these diseases are preventable. An interesting fact, during the War of 1812, more soldiers died from disease than fighting. In 1900, life expectancy in the United States climbed to 46 for males and 48 for females, with the leading causes of death being influenza and pneumonia, tuberculosis, diarrhea, and enteritis. Not much progress was made before the 1900s. During the 20th century, however, the average lifespan in the United States increased by more than 30 years. By 1950, our life expectancy had risen to 66 for males and 71 for females, and continued to rise until 2014, when life expectancy reached 77 for males and 82 for females. Take a look at the causes of death from 1950 on. You see heart disease, cancer, stroke, and respiratory disease dominate the leading causes of death in the United States. So, as public health initiatives expand, technology improves, and advances in medicine and medical procedures improve, life expectancy also grows. With these changes, we also saw a shift in the major causes of death and disability, from infectious disease to chronic disease or lifestyle disease. Chronic diseases now account for 7 out of every 10 deaths in the United States. Lifestyle has the potential to help control premature death and disability and to improve overall health. Here's the breakdown. Cardiovascular disease and cancer account for about 50% of our deaths in the country, many premature. As you saw, we are now dying of chronic diseases, which are caused by our unhealthy lifestyles. There are many lifestyle diseases in the other 50% as well. Here are the 4 leading causes of chronic disease: poor diet, inactivity, excessive alcohol consumption, and tobacco use. All modifiable health determinants are the 4 most significant factors leading to chronic disease among Americans today. I understand you are young and chronic disease is a long way off. I would propose that beginning now is your best defense. We will pick up with student wellness, health behaviors, and determinants of health.